Welcome back, everyone. 80 million Americans suffer from hair loss, and 40% of that is women. There are several options to treat hair thinning and loss.
So nurse injector Kayla is here from Utah Facial Plastics to share some information on non-surgical hair restoration treatments. So glad you are on the show. Yes. Welcome. This is a big deal for a lot of men and women, and UFP offers hair restoration. What's the first step if you'd like to seek treatment?
So we advise seeking treatment once you start to notice hair loss in certain areas on the scalp. We do advise that you follow up with your primary care physician beforehand, just so they can assess if there's any contributing factors. Once they've okayed with the surgery, then we'll set you up with a consult with one of our medical directors from there.
That's amazing. Okay, so you guys offer things like medication, a lot of different options, but what are some of the non-surgical treatments that you offer?
So we do offer like a supplemental option, which is called Nutrafol. That just contains minerals and vitamins that will help thicken the hair follicle. We also offer prescribed options, orally and topically, like finasteride or minoxidil. Those both help block the THT hormone that's responsible for hair loss.
Is that the issue? Are we dealing with, when it comes to men and women, is hair loss because of hormonal changes?
That, and it can be genetics or environmental too.
Stress?
Stress is a huge thing, yeah.
It's so frustrating too, because you're like, it was there last year, and is it thinning now?
Exactly.
It can be tough. Okay, so talk about PRP injections.
Okay, so PRP injections, the way it works is we will do a ring block, which will numb the scalp to make you more comfortable during the procedure, and it minimizes bleeding. And then from there, we will draw your blood. We'll put it through the centrifuge machine, and it will divide your plasma into white blood cells, red blood cells, and platelets. We take the platelets out and inject them into the scalp, and that helps stimulate that hair growth again. I forgot to mention we do combine it with A-cell, which is another protein, so that helps stimulate it even more. After that, we use a microneedling treatment, and that just helps it absorb within the scalp.
Take us through the process after, the care, taking care of this. Once you're home, what do you need to do? What does that look like?
We do advise that you don't shower that day, just so it can absorb into the scalp, like I said. You will need to expect some swelling, redness, discomfort, and possible bruising, so you can do like some cold compresses to help manage, or something by mouth like Tylenol too.
We have before and after pictures that you just saw, and it is a huge difference. What are patients telling you? What do they notice?
They notice first that it starts to thicken over. It does take a 4 to 6 month time frame to notice an outcome, and they see improved hair growth as well in those areas. It's not going to last more than a few years, though, so we do advise that you come back.
I was going to ask about that. Sometimes if you're not seeing growth in maybe 6 months, can you come back and get a second procedure?
Yes.
Right away?
Yes, within the 6 months. We just would like to assess. We always tailor the treatment to fit the client's individual needs.
Kayla, what are the areas that you see thinning? Where are you treating the most?
A lot on the crown for men.
Okay.
And women, it's a lot more in the frontal areas.
Really? Mm-hmm. And does that work for all of those areas?
Everyone varies. Again, we like to see you back, and we tailor the treatment to fit your needs. So,
are you seeing it more with women or with men coming in to see you?
More with men, because like I said, that THT hormone that's responsible for hair loss, it's caused from testosterone.
They also do a hair transplant surgery. So if you are dealing with advanced hair loss, is that an option?
Correct, yes. And that's when you would want to see one of our medical directors for that.
All right, everybody, UFP offering $500 off PRP for the month of June. So if this is something you've been thinking about and saying, would it be right for me, definitely go in and get a consultation. I know you have 2 locations.
Yes, we have one in Draper and one in Layton. Our primary care physicians right now is Dr. Henstrom and Dr. Thompson.
Well, I love them both.
Yes, we will be offering a 3rd surgeon, though, JP Manning, this fall.
Well, and June is your month, $500 off. That's amazing.
Yes.
So great. Well, thank you so much for sitting with us, and thank you for this sponsored segment.
UtahFacialPlastics.com for more, everybody. As always, that will be on our website. All right, Dina, what is coming up next in the kitchen?
Oh, we are mixing up a new guacamole.